Hey, we're going to be live and on the air in just a few seconds with a great interview and a great opportunity to introduce you to a new director for North Texas. So join us, share, subscribe, be a part of our movement of Veterans Impact. We're here for you. We're here to continue the mission. We're here to save lives day in and day out. Jim Blythe and Veterans Impact will start in just a couple of seconds. Welcome to the Veterans Impact Show, where we continue the mission of highlighting veterans and service organizations who continue to serve our community and our nation. We're brought to you by Fairway Independent Mortgage and Lone Star Wealth Strategies. Don't worry, retire happy. Welcome aboard. What a great day we've got. If you look at behind me, that is a virtual deal from the USS Midway of their ready room. I'm Jim Blythe, U.S. Navy veteran, so I spent a lot of time in ready rooms with flight squadrons in Vietnam. I'm here because I'm passionate and I'm here to help veterans. And so today we've got a really outstanding program. Hope you share it, join in with me. I want to introduce Nathaniel Smith, whose podcast is running this really great Ascend Podcasting, my beautiful wife, Diane, and all of the people that help me, including the press officers for the various organizations that we work with. And I want to say a special thank you to the PAOs. Now, I want to introduce a very delightful, a really good guy, an advocate for veterans, a man that I've recently met, really good, Director Cave, the North Texas VA Healthcare Director. Welcome aboard and welcome to North Texas.
Well, good morning. Thank you so much for having me on the show. I just want to say good morning, hello to all the listeners, all the viewers out there. Thank you for the time. Greatly appreciate it. I want to say thank you for your service to all the veterans that are out there listening. I'm sure it's going to be a great conversation this morning. I got the sense you and I could have talked at least 4 hours nonstop about some of these issues. So you get with people who are passionate about it. It's the best thing there is. So can't wait.
Director Cave, one of the things that I was so amazed that we talked about on Thursday when we got to know each other was your commitment to advocacy because you are an attorney. That is your training. And then a lot of people have said to me, well, now, how did he get into the VA? Well, I read his resume and you got a presidential fellowship that got you started. But I think what motivated you and what motivates you in your advocacy is a great quick story to tell us, to give you a background about what you're about.
Thank you so much. And thank you for teeing it up in that way. I always ask if somebody says, oh, he's a lawyer, he's an attorney, I always say, oh, no, please reserve judgment. Right? The general view of lawyers, right? But yeah, absolutely. So, when I was growing up as a kid, I went with my grandfather, who was a chief warrant officer. He served in World War II and then later in Korea and Vietnam. I went with him to the VA in our local city where we grew up. It wasn't Dallas, but I went with him to the VA at different times. And, this was decades ago, but I always had the sense that maybe he could have been treated a little better. Maybe things could have gone a little better there. And classic stoic, generation, he didn't complain about it. He wouldn't say a lot about it, but I always just got that impression. So what better place could you possibly be in terms of welcoming people home the way they should have been welcomed home, improving services, making sure we honor that promise that was made to veterans. If you are injured, you go out there and fight for our freedoms, we will take care of you. What better sacred obligation could you dedicate your life to, your career to, than honoring that promise and making sure veterans like my grandfather get the care and treatment and benefits that they earned, that they deserved. So thank you for teeing it up in that way. That's my why. And could you ever ask for a better platform to do that advocacy from than VA North Texas? This is the largest VA in the fastest growing market in the country, second largest in the nation, depending on how you stack it. And at the rate people are moving here from California, will be the largest in a couple of years.
I am amazed at what's going on. The job growth, the veterans coming in, the tremendous organizations we've got. And for all veterans, whether they subscribe to and go into the VA system or not, let me tell you, some of the things you've heard in the past about the VA healthcare system have changed over the last 7 years. And Director Cave, you and Jeff Milligan and Steve Holt have all been a part of being instrumental in that change. And so you're continuing what we have had as exceptional leadership. And again, a level of advocacy that is really, really important to not only our veterans, but to our community. And you were talking about growth. How many people do you actually take care of versus how many people are in our North Texas area that are veterans?
We have approximately 220,000 veterans enrolled in VA healthcare who are in the community. We serve such a large area. You know, we have different sites of care. We have sites all the way out at Tyler. We have, a Sam Rayburn up there in Bonham. Fort Worth, of course, is growing. We've got Grand Prairie. We're looking to put a location out there in Aledo. We have, a Tri-County clinic. To answer your question, though, we have about 130,000 veterans enrolled and actively using primary care. And the veteran population above and beyond that is much, much higher. VA nationwide has enrolled 89,000 veterans since the PACT Act. I know we'll talk about PACT Act a little bit later, but those numbers are just staggering. Some of the outpatient clinics here, like Fort Worth, for example, 30 primary care teams out there. There are VA medical centers in our system across the country that the entire system doesn't have 30 patient-aligned care teams like we do out there at Fort Worth. So it's dizzying, right? It's a wonderful thing. From a management standpoint, it puts us in that positive mode: hire, build, grow, yes, expand, right? We're always doing more. We're always trying to build. That's very exciting. It's very positive. The flip side of that is it is also our largest strategic challenge. If we can't stand up a brand new care team almost every 90 days, basically, then appointment wait times and those sorts of things is going to go downhill, right? So it's an obligation for us to rise to meet that challenge. And at an appropriate time, I might do several shameless plugs for hiring for VA. That means we need people.
Okay, let's do that plug, and it isn't shameless. Where can people go to find out and apply to work on the VA? Now, I want to make a point too, because a lot of people don't realize, they think of the VA as the big hospital down on Lancaster in South Dallas. That's not true. We have a hospital in Garland that was just acquired. You have facilities. You basically have 38 counties in the North Texas area, plus 2 counties up in Oklahoma. So I know it's not just about a job in Dallas at the big VA. They're all over. So how do people go about finding out about these jobs and applying for them?
All right, so excellent. Thank you so much. And so, the best and main site is usajobs.gov. If you've never used it, what you kind of have to do is set up a profile and you set up your USA Jobs resume. It can take some time to do that. There's a bunch of different components of that. But the good news is once you get it done once, that then works for, thank you, you've got it there, all of the applications you put in once you go through it once. So you can put in there, you've got it there, location. You could say Dallas, you can put in the zip. You could search just Veterans Affairs in the keywords. You can search North Texas VA. There's 100 ways to get at it. This is the principal hiring mechanism, but it's not the only one. We also have been very aggressive here at VA North Texas doing job fairs. We call them job fairs, but they're also really onboarding events where we tee up physicals, fingerprinting, any testing that needs to be done, those sorts of things that we have to go through before we can onboard an employee. We try to have all that located on site at our job fairs. Our social media page, which is at VA North Texas, you can find it. We will be posting those. We did one in March. We did one in May. We're getting ready to do another one focused on pharmacy and radiology. But the bottom line is anyone who's hearing us or listening to us or watching us, If you're a veteran and you're interested in employment, we have special hiring authorities. We can bring you on board fast. We can bring you on board faster than civilians, but that's not to discourage anyone who's not a veteran. We have the best mission of any federal agency. Who can't get behind this mission? You know, there's a federal employee viewpoint survey that they send to all federal agencies, and they ask employees questions about why you do what you do. VA always hits it out of the park on commitment to the mission. People are doing it. When you ask, a lot of times people don't know, and I always am surprised. You know, when you really visualize it, about 35% of our workforce are veterans. And for new employees, I always ask in the room, okay, if you're not a veteran yourself, how many have a spouse, mother, father, brother, sister, or son or daughter who are veteran, who are active duty, perhaps? The number ratchets up above 80, 85%. So, you know, best mission, wonderful opportunities. The benefits are great. And to your point, there are locations all over the place, certainly here across the counties you referenced, but VA nationwide. You know, in my particular background, you know, I've served VAs in Pennsylvania, in New York, in central office in DC, you know, various different places. So the opportunities really are limitless for people out there. VA is coast to coast and beyond. There are VA locations in Manila, in American Samoa, you know, and beyond. So tremendous potential. Check out USA Jobs, and please attend our hiring events.
I think one of the really great things, too, that most people don't know about is 70% of the medical professionals in the United States at one point in time in their career either trained with or worked with the VA. And here in North Texas, I know you have an association with, for instance, UT Southwestern. Down in Houston, you've got an association with MD Anderson. And 2 or 3 of your top people that are on your staff are also top people on the staff of UT Southwestern. So you are trading information, you are learning, and that's how with Dr. Hastings, for instance, you guys did one of the very first heart catheter operations, and a lot of people don't know about these things.
Yeah,
and so that's important.
it absolutely is. And you know, the academic, so the teaching mission. So you'll hear VHA has 4 missions, right? There's the healthcare delivery, there's the teaching, research, and then emergency response, disaster response. I'm glad you highlighted that. Yes, it was a transaortic valve replacement procedure. In the past, they would have had to do the, you know, invasive procedure to get at your heart to do that. Now they're able to go through, you know, one of your arteries in your leg and get up and do the work they need to on your heart. And, you know, you can recover so much sooner. And the chances of, you know, risks and you know, bad side effects, et cetera, complications, I should say, are so significantly reduced with that. VA staff have been pioneers in this area. One of the things I have spent a lot of time doing since being here is listening to the researchers tell me about their projects and talk about somebody enthused about what they do. The folks who are leading some of the research that they're doing right now, it is going to be the things that are saving lives tomorrow. You remember, and I'm sure veterans out there remember, hepatitis C, for example, something that people dealt with their entire adult lives pretty much. And then all of a sudden, bam, a few years ago, there's just a cure. There's just a cure. You know, take a pill every day and it's gone. Right. So we really are on the cusp of so many breakthroughs. I think it's critical to the healthcare delivery that we're not just doing what we do today. We're thinking about what we need to do tomorrow. You know, help make sure folks dealing with complicated issues. I could talk about that all day. You know, but you're looking at diagnoses where, you know, we say a metastatic cancer that 10 years ago it would not have been a treatable cancer.
No.
These days they're able to target things in ways like never before.
One of the things that I learned from all of the former directors and the people that I've met with, like Dr. Hastings and your team members that I know quite well, is with the tremendous number of veterans or veteran family members or veteran associations, you don't just look at what the problem is right here. You look at a lot of the underlying causes, and you guys are treating a broad spectrum. That's one of the reasons why I think the VA is so important, because it's veteran serving veteran and understanding many of the complicated issues. It's not just you got this, there's a lot more to it. And so when we come back, and we're not going to go to a break for just a minute or two, but when we come back, I really want to talk about how the importance of the VA healthcare system puts veterans who have unique problems in touch with veterans who have the ability to understand those problems and help them.
Absolutely. And you hit the nail on the head, coordination of care. And one of the future directions for healthcare broadly is looking at the phrase you'll hear is social determinants of health, which, sounds philosophical, but when you look at it, we've all known this, right? You've got a family member who went to the doctor, they've got some issue, and it's going to be a treatment, whether it's a pill regimen, whether it's a, physical therapy, they've got a path to walk ahead of them, right? One of the keys in determining whether that person's going to be successful or not traditionally is, for example, who's the caregiver, right? With my grandpa, for example, his spouse made sure he took the pills, right? His family member made sure he was on top of what he needed to do and was helping them, him understand what the doctor said and taking those notes. Your family and your support system is key to your health. It's key to your ability to stay on top of your health. So you hit the nail on the head there with coordination of care. VA is really branching out into other things. We could talk all day, of course, about veteran homelessness, for example, but these things are all interrelated. If you're struggling financially, if you're struggling with homelessness, if you don't have a social support network, you don't have family and friends checking in on you, chances are you're going to be at greater risk in terms of treating your health care. Right. So we don't want to just patch you up and send you back home, send you back out to whatever situation brought you into the emergency room. We want to hit you with a comprehensive treatment plan that's going to address those underlying root causes.
That is so important. And I was on a call, and we had two of the directors from VA Washington talking about isolation, talking about loneliness. And the percentage is amazingly high of how these underlying factors then lead into complications with underlying health issues. In other words, you're putting bad fertilizer on a plant that's going to get out of control. I got to tell you, this is a great interview. I'm interviewing Jason Cave, the director of the North Texas VA healthcare system, the second largest system in the United States, and probably growing at such a rate. Now, we mentioned the number of people that are being involved, well over 100,000, well over 200,000 altogether signed up. I don't know the exact number, but we have somewhere probably between 500,000 and 600,000 veterans in the North Texas area, and we're here for you. And when we come back, we're going to talk about also community involvement and community commitment with Director Cave. I'm so excited about this thing. I'm not paying attention sometimes. So thank you for being on board.
Thank you.
Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now let's continue this great conversation. Listen, this is one of the best interviews that I have ever had the chance to do, because it affects every veteran across the nation, and that's the leadership of the VA. One of the things we've talked about is customer service and advocacy, and that's something you're very much behind, Jason. It's also something that I want to point out that is the VA, a lot of times people have the wrong conception. I run into that all the time. As we stack up against civilian hospitals, you guys are in the top of the United States. You are in the top of the VA healthcare system, but you compare to any of the best of the United States. True?
So there's a million ways to measure everything. So the VA North Texas is among the best in the country on technical quality of care, right? Which I think is a great segue into emblematic, rather, I should say, of where we want to go with the system, right? In years past, hospitals, healthcare is very institutional. So we look at you as you're a series of diagnoses. You have all these problems. We're going to fix each one of those problems, right? We're trying now to look comprehensively at every contact with the system. So you're correct, right? Technical quality of care. How well does your healthcare organization manage the diseases that you have there? How well does the hospital take care of the people who are admitted to the hospital? And you're right, VA North Texas does tremendously well, among the best in the country on all of those things, right? My priorities, my goals here, really my plan for VA North Texas is, what are we hearing from veterans who we serve? My priorities had better be your priorities, right? And so what we're hearing is, all right, there are aspects of the experience, though, that are not quite where that technical quality is. Let's just say, if you had trouble getting through the phones, or you had a hard time finding parking, or, some other thing was like that. Let's say maybe somebody was rude to you at some point, right? That sticks with people. That affects the overall experience. We want a healing environment of care where people are open, where veterans can let their guard down, where they can know that they're going to be people understanding and supportive, right? So we really are looking to build comprehensively an experience that matches that technical quality of care. But to your point, right, we're looking to improve. We're always mindful of our community partners. We're all in the community, right? We're all across the Metroplex here. It's the same integrated healthcare market. The recruitment issues, the kind of the changes we've seen through the pandemic with burnout being a factor for healthcare and things like that. These are things we all are sharing in common, but we want to build the world's best experience to match the world's best care.
Without a doubt. And the comprehensiveness, which is a word you've used, is very, very, very foremost in what you guys do. And I have probably a great example in dealing with a family member who has underlying mental health conditions and has substance abuse and alcohol. And what we found was no place in the state of Texas could we get both treated together due to some legislation things that happened. Yet the VA, for instance, you have a comprehensive approach to substance abuse. Could you talk about that for just a minute or two, please? I think it's important for people to know when we're talking comprehensive, let's define it. And I think substance abuse is one.
Yeah, you're so spot on. So first off, sorry to hear that that's touched you in your life and that you've got folks struggling with it. Almost everyone does, either personally or somebody who they know, somebody in the family, right? So yeah, it's critically important that we don't just, for example, say somebody's readmitted to the emergency room for alcohol use disorder, for example. You can patch that up medically and send them on their way. But if they're going to go right back to old habits, old friends, old environment, and they don't have other courses ahead of them, it's so easy to fall back into that cycle of addiction. So one of the things VA does, and of course VA North Texas has a tremendous footprint of, is our residential rehab treatment programs, right? We call it the domiciliary. So there's one in Bonham that's one of the largest ones in the country. We also have one here in Dallas. And the idea here is, once you've stabilized medically, you've done that initial detox period, right? The next 45 days, it depends which program you're in, but over the course of several weeks, we integrate mental health care, we integrate group therapy. Peer support specialists are a critical component of that recovery journey. I think everyone at some juncture or another, no matter what you're dealing with, has had that feeling where you say, nobody knows what I'm going through. No one knows what it's like for me. I think it's critically important at that moment we have our peer support specialists. I have to tell you, some of the peer support specialists in the system are some of the best people I've ever met in my entire life. I digress, but storytelling, right? My first week in VA, I did a training where you sit back to back, and what's supposed to happen is one person's describing a picture and the other person's supposed to be drawing it. And what's supposed to happen in the exercise is their drawing is supposed to look awful. It's supposed to look nothing like your instructions, right? That's how difficult it is to communicate. This was the best listener I've ever worked with in my life. Our picture looked pretty darn good, And I asked him, I said, so what is this position that this guy is so good at listening to me and everything, right? He was a veteran peer support specialist.
I have a feeling I know who he is. He used to be my co-host, but he lives out in Rockwall, or he'd be here right now.
Yeah,
And they are all great. And we have
yeah,
a lot. I've been through military peer training for suicide prevention. And I know as we get into the next portions of what we're going to be talking about in segments, we're going to talk about the importance of suicide prevention, because you and I talked about that day before yesterday, and your advocacy towards, if we got one, that's one too many.
correct.
And I think that's important, because the VA has got to be the linchpin of the medical help to stop that, to change that.
Yeah, absolutely, absolutely. And this is one of those that everyone who hears us can get involved with. So, absolutely, looking forward to it.
This is a total community effort. Well, I've got Director Jason Cave, who just came to Dallas, and he's taken over our VA North Texas healthcare system, the second largest in the United States, 40 counties that he's over, the huge hospital in South Dallas, but facilities throughout. You want to know more? Go to VA North Texas, take a look. If you want to know about a job, we posted that. We'll put that up again. Take a look. There are tremendous opportunities, because what Jason's telling me is he's on a growth curve and he needs really good people, and they would love to hire veterans.
Yes.
So we're going to be right back after these words from all of our partners. And we want to thank you very much for being part of Veterans Impact Show. We're here for you. You join us. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. We've got Director Jason Cave of the VA North Texas Healthcare System. What an amazing man that I have enjoyed talking to now twice, and I'm glad to have him on board. It's the level of quality that I have seen in the leadership since I started broadcasting and bringing the VA on board. I've met both of the last two secretaries, and truly great men and women who are working in our VA. If you want a job, again, we've got the information to go join this great group of people for a mission that really is continuing. One of the things that we've talked about, Jason, is the PACT Act. And there is a deadline coming up to get retroactive benefits. But let's define that and let's talk about that for a minute, because I think it's very important.
Absolutely. Thank you so much, and appreciate the kind words. Humbled and honored to serve in this role and in this capacity. So,
What, an attorney, humble and honored?
yes, yes. I'm glad you were sitting down. So the PACT Act is legislation that was signed back last year, and it greatly is the largest expansion of veterans benefits and eligibility for decades. So everyone out there who knows veterans who served in different time periods, they know the stories where there are things that you may have been exposed to in the line of duty, right? So you may think Agent Orange, maybe white phosphorus. In modern days, you think about open burn pits, right? Afghanistan and Iraq. And so people may have been exposed to these, environmental toxins that contribute to one or more health conditions at some point. And so the PACT Act greatly expanded several benefits for those and VA eligibility for some of those conditions. So that's it in a nutshell. The important deadline that you're talking about here is coming up, in fact, here in August. And it doesn't mean, I want to be very, very much abundantly clear with folks, it doesn't mean you can't file claims after August 10th. You still can. There's a limited window that the benefits, if you get new ones, will be retroactive back to the date the law was signed. So that's the key. If you haven't done so already, that's the one most important takeaway here. File a claim, file an intent to file a claim, which is a specific form. We won't go down the whole rabbit hole with that, but you've got to do that over the coming weeks in order to take advantage of that retroactive component of it. You can file with a county service officer. You can file with Veterans Benefits directly. We have an event on July 27th coming up at our Garland location. We'll have 24 VBA staff there helping veterans file claims. We've got about 200 appointment slots left for that. VBA will sit down and work through the entire process with you. You don't need a lawyer or representative. There's some of these folks that are emailing people and saying, we will help you. You don't need any of that. We can sign you up and work through that live at the event here. So last thing, I'll shut up on this. If you filed a claim previously and it was denied, it does not automatically get resurrected and evaluated under the new PACT Act standards. That is super important. So if someone filed one previously based on some condition and it was denied, it doesn't automatically get looked at again. So dust it off, file it again, and don't delay.
One of the points I'd also like to make, and which we've said before, this is not your grandfather's VA. This is a new VA today. One of the things that you guys implemented several years ago is telemedicine. You don't necessarily have to go into the doctor to be able to utilize telemedicine. There are a number of things. We talked about the heart catheterization. We talked about the other initiatives that the VA is doing. One of the most important, I think, is telemedicine. You don't necessarily have to go in. You can connect with a doctor using telemedicine as long as you've got a cell phone or a computer. These are innovations which are nationwide. Now, you also mentioned signing up the County Veteran Service Officer. For people in other states, they don't have County Veteran Service Officers. But let me tell you, VA accredited reps who are not hired attorneys, but they are for free, are with the DAV, the VFW, the American Legion, and thanks to County Veteran Service Officers here in Texas, for listeners that I've had in other states, Virginia, for instance, California and others, I've been able to connect people with VA accredited reps, not attorneys, VA accredited reps. And you're right, that is a free benefit and they will help you. But you also have people on staff that you're going to have July 27th. And how does somebody go about getting an appointment to get one of those 200 slots?
So we're using Eventbrite. I think everybody probably has seen it at some point. Just go to our social media page. You'll see the event upcoming. You click on it, we'll plug you into a slot. That's how we're doing it. We have about 280 appointments already booked. You don't need to wait for that though. I mean, we do have VBA reps on site here at the main campus here in Dallas. And folks certainly can, go to benefits.va.gov and connect with VBA. But so go to the social media page if you want to participate in the event. It is going to be fun for the entire family. We are going to have a lot of activities and events out there. VHA will be out there in force as well. Enrollment, eligibility, everything we've got. So that would be the best place to go for that.
I think that's important. People, you need to know that the things are there that can save your life and can help you. We talked about burn pit. We talked about Agent Orange. There's a new thing coming up that I get blasted on the internet because I was in the Navy. How about firefighting foam? That's something that's coming up right now. And let me tell you something. If you went through any kind of Navy training, you got to do firefighting and you got to deal with that stuff. I don't care about, you maybe want to make a few bucks off of it, a class action suit. You ain't going to get that much, trust me. Yeah. But you need to get in line and you need to get in there because there are things with all of these toxic things that could affect you down the road. You may not be hit with it right now, but there's things down the road. So you need to get in the system. Let me tell you, I've been through the County Veteran Service Officer. I've got my stuff all done and ready to go. Yeah. This is important for people to know. Now,
as long as we're hitting people on that front too, let me add, if for any reason somebody's saying, just brought in a little, your spouse, your family members, others as well, there are benefits, for veterans that extend to those family members. So, just to add extra momentum behind the plug you were making, not only is it important for you, it's important for everyone else in your life. There are benefits that may inure, that may support them at different junctures in life, even if you're not per se interested in your own.
If I may interject, I had a call from Richmond, Virginia, of a family that was taking care of their World War II veteran father, and they were really having financial problems. And I connected them, thanks to our veteran service officer here in Texas, with an accredited rep with the American Legion. And within weeks, they had the aid and attendance pension, plus his wife became a beneficiary of benefits. And so they had about $2,300 a month of income coming in that they didn't get before.
Yeah.
Plus they had expanded benefits, and you've got all kinds of things going on there that can help that veteran.
Yeah.
If they don't know.
Yeah, it's sitting out there, and he earned it. I to this day have some friends that went into service that say, VA is not for me. It's for people who are sicker than me. Or these benefits, I don't know how they earned it. Goodness knows, you've heard the thing, write a check, at some point wrote a check up to and including their own life for our freedoms. So goodness knows they earned that. So absolutely, to your point. And you've mentioned DAV, VFW, those others, and Texas Veterans Commission. I ought to at least take a moment here or two. I'd be remiss if I did not say we cannot do our mission without the support of our veteran service organizations and the nonprofits and everybody who helps us. We are not the only organization devoted to veterans, devoted to supporting veterans, and we really could not deliver if it weren't for the support we get from those organizations and from the community. Some of the best people I've ever met in my entire life are those who are working at those organizations, helping steer veterans, helping them navigate the system. I'm here to tell you, if anyone thinks you know the entire system and you know all the rules and the regs, not true, right? Definitely not true. You can be an expert on eligibility, you can be an expert on financial things, whatever it is, but it really does take a team to help people navigate to the right place and to get where they need to go. So thank you so much to all those VSOs.
I want to make a plug too, when we're talking about benefits. The program that we're going to have on Saturday, July 29th, will be with a benefits director from Vision 17 from down in Waco. And you know that person quite well, Jason. And you said to me, that guy knows everything. And so we're gonna plug this in and make a program just to talk about that. And then I have Terrence Hayes, who is the PAO for our secretary, who's going to help me do a deal for certified senior advisors to help people know. And you know why I do this, Jason? I go in and work with seniors in many cases, just like your grandfather, many cases, I'm sitting there and they're suffering from something. The most frequent one is hearing. And I said, well, why have you got this problem? Well, I was an artillery commander in Korea. I was an artillery commander in Vietnam. Do you know that you could get hearing aids? I'll never go to the VA. They don't take care of it. No. And we set them up, and every one of them has gotten about $6,000 worth of hearing aids, and every one of them has gotten a disability check as a result of that. And every one of them can take that disability letter and get their ad valorem real estate taxes in the state of Texas reduced by that amount. Whoa, triple whammy.
Yeah, it's near and dear to my heart. I married an audiologist, right? So to your point there with that benefit, so audiology, hearing aids, and prosthetics are among the most heavily utilized services inside VA. It can end up costing quite a bit, to get completely between the fittings, the adjustments, the equipment, and the technology's come so far. I mean, they're better and better now than they were. Huge quality of life impact that you're talking about there as folks are navigating that. People deal with that for years. I'm sure you've got stories, decades. People will deal with that, and then when they get fitted with a good set and it's calibrated properly, game changer. All of a sudden, you're back engaged with people, you're back engaged with the world around you, game changer from a mental well-being perspective, physical well-being perspective. Yeah, I would encourage anyone out there, do connect with VA for that if you're experiencing, any of those issues with hearing.
Absolutely. And I think it's really important to be redundant, to go back. When you go in and you work with the VA, it's a comprehensive program. We've used that word many times because you're maybe not just looking at hearing, you may be looking at other problems that you need to get some help on. Now, I want to make another point. We talk about the VA and the benefits because I was one of those that wrote that check and was on aircraft carriers in Vietnam. Here's something that most people don't think about. They go, well, get the VA benefits, got to go in the military. The military provides those benefits. That's part of what we earned. But those benefits would be a killer thing to have if you'd never served and were a civilian. How many people do you know around flight lines of airports or around heavy trucks or equipment and noise and have these problems? How many people do you know have actually been exposed? Think about Love Canal and many other places in the United States, or drinking water. We as veterans have a benefit that we've earned that the rest of the nation would give their right arm to have.
Yeah, absolutely. And to your point, and some of the best people, some of the most committed professionals I've ever met in my life are those that are advancing some of that care.
Now, one of the other things, and we've got about 4 minutes left, that I want to bring up, you told me a story, and it's a slight change, but we're talking about community relations as well as part of the total care and being able to reach out. During COVID, you did something that I was really amazed about. If you can mention what you did to help the fire departments in your local areas.
Thanks so much. So yeah, absolutely. COVID-19, I'm not even going to say anything else. Everybody, I think we all feel the exact same about that. But sometimes it can sound and feel a little bit like VAs are isolated, right? Because federal standards instead of state standards and all this. VAs are part of the community, and our employees are intrinsically linked, right? So when we mentioned the 4 missions earlier, the 4th mission being disaster response, emergency preparedness. And I did train as an emergency manager. I had the chance to go to Centers for Domestic Preparedness in Anniston, Alabama, where they trained, formerly Fort McClellan. And, I love that training, that whole field. You get, even doing exercises, you get a little bit of that almost 9/11 spirit of service. Whatever your frustrations, whatever your disagreements, let's pull together and save lives, right? You get that feeling. And if I had to say what was the silver lining on the pandemic, it would be that. We forged relationships together with our community healthcare systems, with our first responders that will last forever, right? And so the VA, certainly the one here at VA North Texas, just as an example, flighted in a military craft, right? Flew all the spinal cord injury veterans from San Antonio up to take care of them here to free space in San Antonio to take about 30 community admissions of COVID-19. And we're not talking light cases. These were the sickest of the sick at the scariest times of the pandemic. You guys remember when it was, you were hearing those estimates. We're going to be 60,000 ICU beds short. We're going to be 40,000, and no one was quite sure what we were dealing with. So Herculean efforts there by every VA. The thing you're mentioning there was at the beginning when there weren't really guidelines out yet in terms of what you need to do to protect yourself. Some of the fire departments and first responders were a little bit in the dark. They are transporting sick people to hospitals. Hospitals are putting in precautions. So we were able to supply equipment, training, and fit testing to the local fire department in one of our areas and make sure that the first responders were protected.
That is so important. You're part of a great community here in North Texas, and we're darn glad to have you. And I think it's important that people get to know you. So share this with YouTube, share this with Facebook, let people know what a great opportunity we've got with great leadership here in North Texas. I think I need to come down there and have my allergies taken care of.
Do it. There's a few things blooming right now.
Oh boy, it's that time of year in Texas. All right, we're going to be right back after these words from all of our partners. And we have a special wrap up here with Jason Cave, the director of the North Texas VA. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. I need to stop for a second and before we wrap up the conversation and say a special thank you to my company, Fairway Independent Mortgage. My NMLS number is 311548 and our corporate one is 2289. Now, the other attorneys in the room can relax because I've taken care of the compliance issues. And I think it's important to know that my company, Fairway, has a Warriors Initiative. We've given away over 300 dogs to be able to help people, service dogs. We are committed to helping veterans, and we're committing to having men like Jason Cave on the air talking about what they can do to help not only our veterans, but our community as a whole. Jason, I think it's so important that what you're doing and what you talked about, advocacy, growth, jobs, all of these things, if you could pick one thing, and I'm kind of going off script, that you would say is your number one priority for the next few years, and I hope you're around for a long time.
Appreciate that.
What would that be?
We've got to rise to the demand. We've got to meet the growth. I mean, we've got all those folks moving here. We need to make sure that the overall experience and everything else matches, what it has been for folks here. That means we need a bigger team. So it touches on all those elements, but it's overwhelmingly, it's rise to the challenge there. There's no reason this should not be the best VA in the entire country from every way you stack it. To your point and to all the generous words and kind offers that you've extended to us, we've got a military-friendly community. We've got a military-friendly state. There's a reason people are choosing to move here and veterans are choosing to come and enroll here. We've got to make sure we honor all of that demand, that growth. We've got to make it a good experience. You mentioned sometimes not your grandfather's VA. There are people who had a bad experience at some point and have never tried again. They will not give VA another chance. So we've got to preserve that sacred trust. We've got to make sure that if they do give us a chance again, we treat them the way they deserve.
And I know your team members who are on your staff bend over backwards. I'm not so sure in other parts of the nation we get as much, but what I've seen in our North Texas VA bends over backwards. People make mistakes. Good grief, everybody makes mistakes. And in the civilian community, those mistakes don't get magnified the way that the press magnifies them in our VA. So my message to all of my veteran brothers and sisters is give the VA a chance because they're going to give you the best possible care that you can get. And that's an important thing. And in terms of education, you guys, I know you've got all kinds of programs going on to be able to help people, and the Military Peer Network that you work very closely with. Again, it's all an integrated system that is working together for the benefit of not only the VA and the veterans, but Jason, the VA has led the way in this nation since World War II. Most people don't realize that. The important impact of the VA. And when there was a time that people were saying, do away with the VA, just turn into an insurance company, they didn't realize how much leadership the VA has exhibited in the United States since World War II.
It's amazing. So first implantable pacemaker, first electronic health record, on and on with some of those innovations. And, you touched on so many important things there. We're working hard to build a high reliable organization. You look at airline industry, some of these others, we want a culture so that every single person here is on board to make sure, we deliver the highest care possible. It's a shift going on in the healthcare industry right now. No preventable medical harm is okay. right? We need to make
Exactly.
absolutely sure anyone, right? Airline analogy, if a baggage handler sees something they don't like on an airplane, I don't want to take off. Same goes for us for healthcare. We're working so hard to build that culture. And to your point there about, coverage and whatnot, we live in a glass house, right? VA is very transparent, and that is my earnest goal and commitment to everybody. We're not here to say everything's perfect. We will be transparent about issues we do have, and we will work to address those and improve those. But to everything else you're saying, there are a lot of things that are done exceptionally well in this system, and we definitely want to make sure people are aware of those as well. It's rare that we have a week that goes by here some survey team is not here, whether it's the Joint Commission, Commission on Accreditation of Rehab Facilities, the Inspector General's office, et cetera. There are so many reviewers who are here to make sure. And people always ask, "Oh, is it stressful? Is it this? Is it that?" No, it helps me sleep at night because no one person has visibility. You mentioned the 38 counties and all these areas. I can't be everywhere at once. I have to count on the fact that we've got lots of people independently empowered to make sure we're doing the right thing every day.
You've got a great staff, and we could mention a few, Kendrick Brown, Alton McKinley. There are many on your staff that are excellent that I'm thrilled to have gotten to know over the years.
Thank goodness too, because it is the largest VA I've served, certainly, and it is there is no shortage of things to do. We were talking, I think, on Thursday when we were meeting about how these days go. It's one of the things I love about VA. Time flies. There's 1,000 meaningful, important things that I want to do every single day. I cannot do all of them. Thank goodness we have a team equally dedicated folks who are here for the mission, bring different expertise and skill set to the table so that we can deliver on this mission.
Let me bring this to a conclusion and say thank you, Director Jason Cave. Let me close with a prayer. Lord God of the universe, we thank you for the protection around our active duty military wherever they are around the world, from sky and sea and on the land. We thank you for protecting them. We thank you for our veterans and protecting them, and having an organization like the VA work and protect them. Thank you, Lord God, for all you do for us. In your holy name we pray. Amen. Jason, what a great day. I think I need to get down there and get some throat lozenges or something.
Do it. It's
allergy.
Yeah.
Jason, thank you for being on board. Let's do some more so people know the VA healthcare system is there for you, and we are there for you. Veterans Impact Show. Share us, join us, subscribe. Thank you.
Thank you so much.